And it's just gonna be a nice little pop. Just like that, a little click there. Good, one more. Good. Hey everybody, this is Dr. Brady. I'm here with Mike here at Kalkstein Chiropractic in Towson, Maryland. And today we have an interesting video here for you. We're going to be talking about rotator cuff injury. And Mike here has previous symptoms, right? A previous condition with the shoulder.
Yeah,
why don't you go ahead and explain that?
About 4 years ago, I tore the labral head of my left shoulder. Was a biking accident. Had to put my bike down, stuck my hand out. Ended up with a dislocated shoulder. It was out for about 6 hours. So it was a pretty solid injury for sure.
Yeah.
Didn't have to do surgery. Wasn't a serious enough tear, but definitely took several months of kind of rehab, PT work to kind of get it back to being able to really even use it.
Okay, gotcha. And does it still give you fits here and there then?
Definitely in overhead pressing motions. You know, if I go a little too heavy in my workouts with not enough of like a warm-up kind of cycle, I'll definitely have like a press where I can kind of feel it like, oh, that kind of rolled a little bit.
Okay.
Haven't like dislocated or anything.
Gotcha. But you do every once in a while get some of the feeling that's unstable.
Yeah, exactly.
Okay.
That's a good word to put it for sure.
Well, today I'm going to show you the range of motion exam and orthopedic exam that we do with a labrum injury, rotator cuff injury, sprain, strain, really any shoulder injury. This is kind of the exam that we do here in the office to know exactly what's going on with your condition. So, Mike, go ahead and face me here, please. Okay. So I'm going through all the ranges of the motion with Mike here today. So with your right hand, go all the way up as high as you can go. Any pain or discomfort with that right through there? No, good. And then all the way back for me. Any pain?
Pop there, but not painful. Just
not pain.
Cracking out the joint.
Okay, gotcha. And then if you could face the table over here, and what I want you to do.
That side?
No, you're good right there. And you go all the way up.
Right hand?
As far, yep. Any pain, discomfort with that movement right through there then?
Nope.
No? Good. All right, so face me here.
Sure.
The first test I'm going to have you do is bring your arm across your body for me.
Right one?
Yep. Thumb pointed down, and then you're going to go ahead and press into my arm right through here. Any pain, discomfort?
A little bit of kind of tightness right there.
In the front of the shoulder?
Yeah.
Same thing through here, press. Any pain or discomfort with that?
No.
Good. And then all the way out.
Nothing.
Nothing there? Good. Now what I want you to do is bring that right arm behind your back for me. And if you could just kind of face the wall so Carly can see here. All right, so what I want you to do is press into my hand right through here. Does that bring any pain or discomfort into the shoulder there?
That's the whole like front head there.
The whole front, okay.
Yeah, it actually felt like that made my arm a little unstable too.
Unstable, okay. Do you ever feel anything underneath your right scapula at all?
I don't feel anything underneath it, but I do have just on the right side, a webbed scapula, just a little bit.
Yeah, so do that one more time for the audience here. Yeah. So you see how much scapular winging Mike has here. Kind of juts out. I can really get my hand underneath that right through there.
My left side's not nearly as much.
And I was just, can you do your left side just for, Still a little bit there, but not anywhere near the amount that the right side wings out there. Good. And you can go ahead and relax there. So there's 4 rotator cuff muscles. They call them the sits muscles. So 1 is supraspinatus, 2 infraspinatus, 3 teres minor, and 4 subscapularis. So depending on those tests that we just did there and your range of motion, where you get stuck, will tell me like what muscle is involved there. Gotcha. And sometimes it doesn't even have to be a muscle. It can be those last like 5 to 10 degrees and it's more your AC joint related. So that's why we're trying to do all these tests to see exactly what's going on with you. But for video purposes, I'm going to act like Mike here has a right subscapularis strain there, and I'll show you how we treat that here in the office. So Mike, if you can go ahead and have a seat facing that blue wall for me. All right, so what I want you to do, Mike, is bring your arm out by your side with your palm up, and what you're going to do is bring that arm behind your back, just like that. Yep. And what that's doing is it's lengthening that supraspinatus muscle and the tendon as I pin down and stretch that muscle. So I'm just working the top of his scapula right through here. So keep repeating that same motion there for me, Mike. Good, keep it up. Good, and then all the way back. Good. And then back again. Yep. So every single time I'm adding more and more pressure, just trying to provide some blood flow to that area, break up any trigger points that he might have in that muscle belly, and overall just restore his normal range of motion there. Good. Feel that right through there. Yeah. Is that too much pressure there, Mike?
No.
Good.
Actually kind of feels good.
Good. Good. Just give me 2 more here.
All right.
He's tough. Yep. Last one. Good. All right. And then you can just relax here. I just want to see the range of motion. If you have any popping, clicking. Any pain or discomfort when I do that in the front there?
No.
Good.
No pain or discomfort. Had a little bit of a pop in that like transition, but
yeah. So with this one, go ahead and bring your arm up like this with your hand there. Yep. What I'm gonna do is I'm gonna reach around here. Drop your arm into my hands here. So I'm gonna block my scapula. And it's just gonna be a nice little pop. Just like that, a little click there. Good. And then go ahead and move that arm around there for me, Mike. Let me know if you feel any of that popping, clicking, any pain with that.
I had a little bit coming up here.
Okay.
Didn't repeat the second time.
Good.
Yeah.
No pain or discomfort with that movement there?
Yeah, no.
No. Good.
And just that one pop at the back there, but nothing else.
Let's go into your back here then for me, please. And like I said previously, sometimes it can be that AC joint or acromioclavicular that's kind of gets stuck in that last 5 to 10 degrees of motion there. So that's another thing I'm about to address and show you how we adjust it here in the office. So if you don't mind looking towards that side there for me.
Sure.
So no, you're good. So just look, yep. And then you're gonna bring this arm over top that joint. My hand's gonna go on top of here. And then you're gonna go ahead and actually reach behind my back, Mike.
Okay.
I'm gonna roll you, yep. Just like that, and it's gonna be a little slight drop right through here. Yep. Good, one more. Good. All right, and then you're gonna relax onto your back there. Good. All right, then go ahead and step on off here. So what we would do with Mike here, if it was a supraspinatus sprain strain, I would want to get a little bit deeper into that tissue because no matter how much pressure I use there, I'm not going to fully get into all the muscle fibers there. So what I would like to do with you would be dry needling and then shockwave therapy to pump out that inflammation and accelerate that healing process. Gotcha. And then after that phase 1 of care with the modalities, adjustments, soft tissue work, I would put you on an exercise program, not only to strengthen it for this condition now, but prevention in the future since you had the shoulder injury. Okay? So thanks a lot, guys, for watching. If you have any questions, let me know in the comment section. Anything from you, Mike?
No.
No? All good?
All good.
Awesome, guys. Thanks.